So we'll go ahead and get started. So thank you all so much for attending today. My name is Nick Vera, and I'm the User Experience and Education Strategist for the network of the National Library of Medicine, Region 2, which is located in Charleston, South Carolina. So, in case you didn't know, tomorrow, October 10th, is World Mental Health Day. So that's why we're going to be doing this today, and we feel like it's very timely and very appropriate just having October be Mental Health Awareness Day. So here's just a quick outline of what we're going to be going over today. It's just three. So we'll start with some mental health numbers, kind of going over what the state of mental health is in the United States. Then we'll dive into some demos with several important websites on mental health resources. And lastly, we'll look at some ideas for programming around mental health for folks who might be in public libraries who want to do a little more programming around that. One thing we will not be talking about today, though, is how to deal with someone who is experiencing a mental health crisis at your library or workplace. We at NNLM recognize that this is an important skill for public service staff, but we just feel like we're not the most appropriate people to be handing out that advice on that issue. We are not mental health experts. There are other folks who can do that, and I highly encourage you to go and seek those folks out, and we'll get to those folks today. So, according to the 2023 National Survey on Drug Use and Health from the Substance Abuse and Mental Health Services Administration, nearly 1 in 4 adults in the United States, or approximately 59 million people, have experienced some sort of mental illness in the past year. That's about 23% of the adult population. Even more concerning is that 1 in 12 adults, or about 14 million people, had a serious mental illness, which refers to conditions that substantially interfere with or limit one or other major life activities. So thinking about quality of life here. The burden of mental illness isn't evenly distributed. For example, young adults aged 18 to 25 continue to have some of the highest rates of any mental illness, with nearly 1 in 3 young adults affected. These statistics are a reminder of how prevalent mental health issues are in our communities, and libraries are often one of the few public spaces where individuals can access health information freely without stigma, making our role in connecting people to resources all the more important. So next, I want to talk and demonstrate a few websites that you can use to answer any questions you might get about mental health or refer patrons to in your work. So the first thing we have is the National Library of Medicine. So NNLM has a resource guide for public libraries, though any library or individual may find it handy, and it includes a section on behavioral and mental health information. We've included the link on that handout if you're following along. So let's take a brief look at the list of resources on the behavioral health tab. So as you'll see on the screen, we are directly in that page. And so what we really like at NNLM is boxes. We like to have everything very easy to find and navigate very quickly. So we're going to go ahead and click on the behavioral and mental health tab right here. And so on this page, you'll find a lot of information. Most importantly, you're going to find the hotlines for anybody who might be experiencing suicidal ideations or in a crisis. SAMHSA's National Helpline, Crisis Veterans Youth Line as well for folks who might not need it, or might need it rather, and then some behavioral health resources as well. So this is just a really great tool to have in your back pocket for folks who might need it at any given point. And moving to the next thing, if we're following along on our slides, we just did that one. We'll go to Medline Plus, which is personally my favorite. It's one that I use quite often, and I highly encourage folks to use anytime they have a health question. So many of you are probably already familiar with Medline Plus, which is great. Medline Plus, for those that don't know, is an online health information resource from the National Library of Medicine, or NLM, for patients and their families and friends. NLM is a part of the National Institute of Health, which is funded by our tax dollars. So I'm not going to spend a lot of time going into all of the details about Medline Plus and what's available here. That would just be too much to cover in one course. But we have another class that goes into much more depth with Medline Plus, and we have a link to the registration page for that class on the handout. Today, I want to focus on finding information about mental health. So the first thing I want to point out on this page is that you can turn the entire site into Spanish by simply clicking the little Espanol button, which is located in the upper right corner under the search bar. So if we click on Espanol for following the cursor, no, go away. We're gonna let them do that. Okay, so what we did here is we changed the whole page into Spanish. So this is really great for folks who English is not their first language or maybe struggle a little bit. This can be turned into Spanish, and it's very reliable. It's always up to date, and folks are at Medline are very quick to go ahead and do this as well. And so for our demonstration, I'm going to switch it back to English, and we can see that it goes ahead and does that very quickly. So the Medline Spanish team, just as a quick tidbit, is made up of individuals who are native Spanish speakers and have experience in health, medicine, and biological sciences. So next thing I want to point out here is clicking on the Health Topics tab at the top of the page will display a variety of categories. So if we go on Health Topics, we can see here we have a huge array of information to choose from. But for this demo, I'd like to show everyone how Medline is really laid out. So let's look at what there is when we talk about, or when we want to find information about anxiety. So we'll start, well, first of all, we can quickly look and see just how this page is laid out. So you can search in multiple different ways, but personally, I like to just do the A, and you can go down and scroll, but for this, we're really just going to go up to the search bar up here and do anxiety, which is a really great thing, and you can kind of see it auto-populate, so this is going to be really helpful if you're like me, who can't spell. Sometimes you can see that it'll populate for you. And we'll just go ahead and click that big green button for go. So as we search, we can see that it lays everything out for us in a very nice and succinct way for us to be able to follow. So for any user who's not sure what they're looking for, this is very deliberate. They might find the Start Here section to be very important. So we're just going to go ahead and click the Anxiety tab, or our first result. As you can see, it kind of gives you the brief overview, but really we want to dive a little deeper. So on this page, we can see, again, our boxes. We love the boxes. And we can see that little Start Here button. So we can see the basics, learn more, everything. But if we click on Start Here, it'll take us down to some quick information that might just be helpful to have in our back pocket. So there's information and links from diagnoses and tests, and also treatment and therapies. And over to the right, you'll see a section titled Medical Encyclopedia. But before we do that, I just want to go down and show you the rest. And this page just kind of goes on and on. But the really cool thing that we really like to highlight, and so you don't have to scroll, is if you just click the little blue triangle at the bottom right, it takes you right back up to the top, which is really helpful when you're trying to quickly find something or go back to look at something. The Medical Encyclopedia is another really helpful tool, which is right under the person holding their hand to their head. So we can see that it provides some additional links, and below that there's a section called Related Health Topics, which is going to be really important as well. So while anxiety and panic disorder kind of dovetail nicely with each other, you can actually click on panic disorder and it'll take you to that next thing to show you what's going on. And the other really fun thing that we like to show folks is when we scroll down to, say, journal articles, you can click anywhere in this box. And what it'll do is it'll actually find you other expert advice and other handouts, as well as a PubMed search that'll take you to related journal articles. So we're not going to dive too deep into that, but if you were to click on those related journal articles, any of them here, they'll take you straight to PubMed, and they have a search already built in so that you can find that information. So we're going to go ahead and click that little blue arrow down at the bottom right. Takes us right back up to the page, and then we're going to go back one, and we can see that there is right over here at the top. There we go. We're right back where we started. So I'm going to go back to the top, and then there's a link to patient handouts as well, which is going to be really important for folks that are in public libraries. So we can go ahead and hit patient handouts, and we can see that there are a few here. So we'll go ahead and click on panic disorder. And if we scroll down, we can see that there is a lot of information on here. But if we keep scrolling down, we should get to, oh, maybe it's the wrong one. Here we go. Patient handouts. Oh, well, this is the handout actually. Yeah. So you can see that there's little images and things that you might be able to print out and whatnot. And the other fun thing about this is you can actually go back to, oh, hold on, I'm going too far here. You can actually put this into any language that you like. So we're going to go actually to demonstrate this a little better. We're going to go back to the Medline page and under multiple languages, which is at the bottom down here. So we'll start at the top, scroll all the way to the bottom. You'll see health information in multiple languages. This is really cool. It has a lot of different languages that you can kind of turn PubMed into, but also has different languages in terms of like handouts that you can do. And there's another box called other languages as well. And you can also search by health topic. So if we look at anxiety again, we can do, there it is, anxiety. You can see that there's all these different languages, and we'll just click on one to show you what one might look like. Let's go back. Here we go. So here is what one would look like. And this is in Arabic. And if we go back one, it actually will have the different side by side. Well, used to. In one of these handouts, we can go back to it later, but what it'll have on the left side is English. So if you're working with somebody who is at like a patient at a doctor's office, they can actually point to the right side being their native language, and it would correspond to that English. So it's a little easier to read and a little easier for folks to understand and communicate with their doctors what that's about. So I'm going to go back to the home page for Medline, and we are going to find medications next. So Medline Plus is a really great resource for finding medications or any kind of prescription that is a part of a treatment plan for someone with mental illness. And so as we all know, when we get medicines, it can be really hard to kind of understand what's on the bottle, let alone read it. So Drugs and Supplements is a really great resource in Medline that allows us to kind of do that for us. So what we're going to do is we're going to look up information on pseudoephedrine, where is it? On Prozac, that's what it is. So we're going to go to the P's, which we're going to use the little alphabet here by brand name. And if we just control find Prozac, it'll take us right to it. So we'll go ahead and click that. And on this page, you can see there's a lot of information already. Don't get too concerned. It breaks it down in a very nice way because again, at NLM and Medline, we love boxes. So it will give you some little prompts that you can choose from and a list of questions that many people might have about a new medication. And we can also notice in here that really important is the red box warning. This will appear when appropriate, so not all medications have it or supplements, but there is, for some, they're going to have it. And it's usually around this red box, which is really eye-catching. It's meant to grab your attention. And we highly recommend you read it. Red box warnings are always really important, and they will oftentimes have additional information that maybe may have been missed. And are there any questions before we move on to the next slide? I'll look at the chat really quick and pull it up. Oh, Rebecca's been doing this for me. Thank you so much.
Nothing has come into chat yet. Well, since you said that though. Yeah, so there was a question from Lisa about plain language and low literacy options. So if you go, so everybody could see if you go back maybe to the logo, your Medline Plus logo, and then scroll all the way to the bottom of this page. there, just above where your cursor is, easy to read health information. And that should be between no higher than 8th grade level. So
Really helpful. I think definitely play around with it, see what's available, and obviously what works with whoever you're dealing with in your community or at your reference desk. I think there's probably a lot in here that you could take away from and use. And also having those infographics in multiple languages could also help kind of bridge that gap in knowledge, if any. Any other questions?
there was nothing else.
Lovely. Hey, Daily Med, really important. Love Daily Med a whole lot. So similar to Medline, it is a really great tool for finding information about your medications. So Daily Med is a joint effort between the National Library of Medicine and the Food and Drug Administration, also known as the FDA. Currently, the database contains over 154,000 labels submitted to the FDA by drug manufacturing companies. So some of the information you can find in Daily Med is things like prescription drugs for human use, over-the-counter drugs, certain medical devices, and you can read more about what it is and isn't included in Daily Med on their website. We have a link to the About section on that handout, which should be in the chat. The labels included in Daily Med are the most recent labels submitted to the FDA by drug manufacturing companies. So I'm going to use the search box at the top of the page, Buried in Life, and we're going to do the same search. We're gonna look for Prozac, and we're going to hit the search. Oh, look at that! It already auto-populated, which is lovely. And we're going to go ahead and click on that first link. But before we do so, no, we don't want to take the survey. Oh man, there's no box to exit out of that. Okay, but before we really go into clicking on it, I want to point out some really useful things. Well, first of all, we get just 2 results, which is really great. It lays it out very succinctly. And when you click on the View More, you can see that it'll first make it really big for you. So if you just want a quick glance at what it is, a medicine bottle, you can quickly point to that and maybe show somebody and say, is this the medicine that you're taking? Oftentimes visuals help in a lot of ways, and you can do the same for this. And that's simply just by hovering. But if we click the View More, you can also see different milligrams. So say that person, they're like, yes, but I don't know, mine's black, it's not really red. Well, there's another one for you. So at least we know that we're on the right medication. But if we click it, first thing we'll see is obviously those images in the top left, but we're going to click on the name and really get that full record. So that's what you're seeing here on this page. This page obviously has a lot of information which can be a little overwhelming, but don't panic. It's laid out in a very succinct way. So one of the first things we see is a black box warning. So similar to a red box warning, it means don't ignore it. Definitely read it. You may also hear it to refer, like I just said, as a black box warning, so definitely pay attention. This is the strongest warning required by the FDA and indicates that this drug carries some sort of significant risk to one's health. So highly recommend that you read the black box warning. Same for the red box warning. And while we're on this page, I want to point out a few more things. So if we scroll down to item 7, we can see drug interactions right here. And if we click that, it shows you different interactions that this drug does or does not get along with. So sometimes, medicines don't play nice together. I know for a lot of medicines, you can't eat grapefruit, right? This may be one of those. So we want to make sure that we read all of those different interactions and kind of get a better idea about what it is that we're going to be taking, or most importantly, what the person is asking maybe of you to find this information. And then the next item I want to point out is item 8, which is use in specific populations. So this is going to be really helpful for folks who are like pregnant or have different disorders, or maybe have different ailments that we just can't see or really process in that moment. So it's going to be really important that when we're looking at our health information that we kind of look at items 7 and 8 on any medication. They're going to be really helpful. And lastly, I'm going to use the big blue arrow, similar to how we have on Medline Plus. We're going to click that, and it takes us all the way back up to the top. All pages in DailyMed have a link in the upper right corner to labeled recalls, which is another thing I want to show you. So it's kind of hidden, so follow along with the cursor. So we see the big label on the left side, DailyMed. If we go up, we see the National Library of Medicine. And if we go all the way to the right, we see recalls right up here in the very top right corner. I wish they would make that a different color, so that's a little more easier to see. And on this page, we can see that there are different recalls for different things that are happening in real time. So this also goes for food, as we can see, veggie spring rolls, check your fridge. And so you can also look in different things as well. So if we click on it, we can see the different types. It has a little message from the company. So it looks like this is a voluntary recall by the manufacturer. Really helpful to see. And if you ever had a question about a different type of drug, so you can probably type that in and you can look up past ones as well. And you can also sign up for alerts. Definitely always sign up for the alerts, especially if you bought those veggie spring rolls. It would be helpful to know. Go get your money back. And so before we move on to the next part, are there any questions about DailyMed? I'll wait a little bit just in case there are.
Nothing yet. I do just want to mention that those labels, the FDA labels, those are the same as the package inserts that come when we get a drug, a prescription, and which I know I promptly throw away. And then this is good to have this backup information, which is in case you've thrown away your label,
Absolutely.
your insert. Yeah.
I totally glossed over that part. Definitely. I'm one of those folks as well, Rebecca. I throw it away and I never think about it. But then, all of a sudden you need it, especially with things like antibiotics or antihistamines, right? They're taken at very different times, and sometimes it's a little hard to remember. So always consult DailyMed if you can and find out. The font is 6 point, or the font is, yeah, no, absolutely, Jeff. They always make it really small. And obviously asking your pharmacist too, if you're able or can. So the next thing, moving on to the National Institute of Mental Health, another great resource. So, and I'm sure if some of you folks might already be using this, but for those that don't, the National Institute of Mental Health provides information on specific conditions and treatments, along with free materials that you can download or order for your library or for a patron's personal use. Now, in terms of ordering, I know we are kind of in a freeze right now, so maybe not order anything, and they might have actually discontinued it altogether, but we can circle back to that later. But when you arrive on the site, the first thing you'll see is, again, we love boxes. A large grayed out box with different health topics. So that's going to be right here on the landing page. And I'm going to go ahead and do a demonstration for bipolar disorder, which is going to be right here. So we'll go ahead and click that. And if I click on the free health information, well, first of all, we can see kind of like to the way Medline is kind of laid out, we kind of get an idea about what bipolar disorder is with a little bit of brief information. But the really cool thing here is that they do have a little video here to show on. We're not going to watch it today, but it's going to show you just a quick synopsis of what bipolar disorder is so that you can get an idea. But where I really want to spend our time is the free health information, which is going to be a lifesaver for folks in public libraries. So on this page, you'll see there's a lot of different materials here, and you're happy to scroll through them. And good thing is they come in Spanish as well, different languages, but all of these are downloadable. So we'll go ahead and click on bipolar disorder just as a quick example. And so this is a publication through the Mental Health Institute, and you can download it. So on this page, we'll go ahead and click that first publication. We're in it. And lastly, we'll notice down here the download PDF, and then in Espanol as well. And if we scroll down a little bit more, we can see that there's different types of information in terms of like a little chart. So it kind of, again, gives you that brief underlying idea about like what bipolar disorder is. And at the top of the page, we can see the brochures and fact sheets, which is really cool. So here's just a quick page about it, but if we click on bipolar on browse by topic, we can see that it's going to be right here. And again, it takes us back to those publications. So you can always come and download those as you will, which is going to be right here. And once we get into it, just hit download. So the Institute, yes, so the Institute has suspended print orders, but you can still download these materials as you need. Kind of happy I remembered that. You can always go back and download as much as you'd like, or even kind of edit them, or not edit them, but see them as you want in terms of like font and things like that. So if you need to make them bigger in Adobe, happy to do that. But are there any questions before we move on to the next resource? Do NIH, Medline, and all have the same information? For example, with the bipolar page on all three essentially say the same thing, or should a patron look at all three? That's a really good question, Sarah. I think there's different handouts in each one, so I would personally start, just my own recommendation here, not saying you have to do this, but Medline is usually a great one to start out with, I think. And if they do want more information, such as a handout, I would say the National Institute of Mental Health would be another great one. But if it's a question that's I want to learn more about it, I would highly encourage you to start with doing Medline and kind of branching out from there. And if it's a researcher, then kind of pulling in PubMed as needed, looking at those journal articles. But what I really love about Medline is it outlines all of that for you, kind of in those health topics like we were doing with anxiety. We can go back for a second. They always want surveys. Yeah, so like I said, it just outlines it a little better. And it's a little easier to read, and you can kind of make it your own. But really great question.
Nick, can I interrupt a moment?
Yeah, of course, go ahead.
So there's a question from Cameron about, seems that many of these rely upon federal sources and funding, and are there alternatives? So we don't, I mean, I Google alternatives, but a couple of things that you can help you determine if something is current, regardless if it's the Institute of Mental Health or Medline Plus. Actually, I haven't looked on this page, but there should be an update date at the bottom. So I know in Medline Plus, in specific health topics, when we looked at the anxiety, we'll see here we have revised 2025. So, which just above the disclaimer on the right there. In Medline Plus, each health topic page also has, the last update date in those. In Daily Med, for example, where we were just a moment ago, and the same for, I think, Medline Plus, I'm not sure, but there's the label, so towards the top on the right here, the RSS feeds. So if you subscribe to the RSS feeds for either a particular drug, a particular health topic, yeah, right there, you're going to get the latest whenever it was last updated. And so for this particular Prozac here, it says it last updated November 13th, 2024. So I think that's the most important thing. And, to be transparent, we're funded by the National Library of Medicine, so we don't spend a lot of time looking at resources that are not related to the National Institutes of Health. So.
But great question overall. Yeah, I think a lot of folks are really interested in knowing when things are updated and most importantly, like how to stay tuned for other stuff, right? But definitely pay attention to those dates at the bottom as well. Because I know with things kind of happening at the federal level, it can be a little hard to kind of keep up, especially during a government freeze. But next up, we have the Substance Abuse and Mental Health Services Administration, SAMHSA. So SAMHSA, pronounced SAMHSA, stands for the Substance Abuse and Mental Health Services Administration and is part of the U.S. Department of Health and Human Services. Its website includes information for the public and for health professionals. Topics include school and campus health, seeking help after traumatic events, such as a natural disaster, or a shooting. Some of the links on this page, which we'll go to now, may look very familiar, as we've already pointed out. So for example, I'll scroll down and get through the get help line, so we can start to see a lot of those same phone numbers that we saw on the LibGuide that we had, or the toolkit rather, on the first page for the resources for public librarians. So the crisis hotline, disaster stress helpline, national health hotline, very important, always kind of at the forefront of everything we do. And so we're going to go back and do a little demo to the navigation at the top of the page to show you kind of how SAMHSA is laid out. So I'm going to click on the mental health link, which is going to be on that gray bar right underneath the logo. So we're going to go for 2, 3 over, and we're going to click mental health. So in here you'll find, again, we love boxes, everything's already laid out for you. You can find a variety of information all on here. So anything from trauma and violence, suicidal behavior, disaster preparedness, all really important. Don't really quite have the time to go through all of them today, but we do want to show you some other cool things. So SAMHSA is also a really good resource if you're planning a program. So I'm going to click on the libraries tab, which is going to be on that gray bar, just a few more down between data and about. So we'll go ahead and click libraries. Now, here you'll find a lot more information, publications, evidence-based practices, things like that. But what I really want everybody to pay attention to, if you don't take away anything from today, it's kind of a hidden link. So this is a little unassuming title, but it's actually a link. So under libraries, we're going to click on libraries again. And what this is going to do is it's going to take us to a new page where there's going to be a lot of information and some downloadable content for us to really take a look at. And so I'm going to scroll down a bit and we're going to see a section called Publications for Professionals. And before we go down, you can kind of see there's a search bar if you wanted to search the library for other things, for like substance abuse, for example. But really down here, you'll find some fact sheets for the public and fact sheets for publications for professionals. So doing so, we're going to go ahead and click on publications for the public. And so in here you'll find a lot of toolkits, mainly for things for overdose prevention. Really, it's endless. There's just so much to kind of go through. I get excited thinking about it and seeing like all this cool PDFs that you can download and hand out to folks if they need it. But this link does take you to those resources and can be used at a host of events or even social media posts if you're thinking about it. But we can go ahead and click on one of those toolkits. So we can do overdose. And we can see that there's the toolkit right here that you can download. And it also gives you a little bit of synopsis of like what's in it, the language, things like that. Any questions before? And this is also a really great one-stop shop for kind of all your mental health needs. And there are available resources as well. So if we go back one, we can see that there's a lot more in here. And if we scroll all the way down to the bottom, it actually goes on for a few more pages. Now there is no little triangle in the far right, so you will have to kind of scroll up a little bit.
Nick, there is right there on the one of the top filters. No, at the top of the page on the left there. We can drill down a little bit on the left and hit the mental health filter.
Absolutely.
There you go. And so now we have a few less to go through and might be a little more, but I still see substance use, but yeah.
Do you offer social media toolkit resources, really helpful information? Yeah, I think there's actually some really cool ones that are coming up. So we'll get to that very shortly, Allison. But let's go back to the digital toolkit section on the left navigation page. Let's go over here. Let's go to libraries. So here were those digital toolkits. But if we scroll all the way down, so how I got here, let's go back one really quick. So we're going to go into the digital toolkits now. So what we're going to do is we're going to go to libraries, and we're going to do libraries again. And then we're going to scroll all the way to the bottom. And there is that toolkit here for overdose if you're interested. And then for the public and for professionals. But if we keep scrolling, we'll see related pages. And the really cool one that we always like to give a shout out to is Observance Digital Toolkit. So this is really cool for like Mental Health Awareness Day. So once we get in here and we click on it, we can see treatment month toolkit, prevention day, alcohol awareness month, and they also on the left side have different types of health information in terms of like national grief, mental illness, children's mental health day, back to school, which can be really stressful, substance and misuse. Yeah, the kind of list goes on, but really, if we click on one, we can see if we access the toolkit, we can see different messages, and it kind of lays it out for you. So Allison, here's where you'll find those social media posts and things like that. These are all ready to go, and you can download them. Easy, easy peasy. The work's already done for you, and it even gives you a little snippet if you wanted to put that in the caption or the alt text if you wanted. So highly encourage folks to take advantage of this since, a lot of that work is already done, so we don't have to be in Canva creating new material. Everything's here, and it'll even break it down into weeks for you. So it's a 5-week thing, hashtags, observances, different images, really cool stuff. So if you wanted to put that as your background, highly recommend. And the best part, it gives you tips for engaging in respectful conversations about mental health, because as we can all know, it's a really tough thing to talk about, but the folks at SAMHSA really give us a head start in having those and how to have those conversations. So we covered a lot on this page. Does anybody have any questions about SAMHSA? Anyone for Breast Cancer Awareness Month? Thank you. We can circle back.
Well, there's the Cancer Institute, National Cancer Institute, that you might all check out for that. That's a different topic, but they may have something there. Nick, I also pointed out to Allison, because she asked about the social media, that we do have a link on the handout. The Institute of Mental Health has also social media stuff, resources as well.
Lovely. And yeah, it is Breast Cancer Awareness Month too, so it's timely. How many of these or are any of these resources indexed in PubMed and shareable? That's a great question.
So PubMed is a database of citations to journal articles, and you can find a few patient handouts that come from journals such as JAMA, Journal of the American Medical Association. So these pages, Nicholas, I don't think would be in PubMed. I also I don't remember, before you go on, I think you're going on to programming soon. Before you do that, if you would jump back, do you have Medline Plus open? I just wanted to show folks, and if you would you just search for anxiety in that search box again, the top search box, just to get some results? I know we're on the anxiety page, but that's not what I want to show. Okay. This is what I want to show below that top box. So somebody was asking, we talked about earlier, other resources, and Jeff put some other like non-governmental resources, and Jeff put a few in chat. WebMD, which I think does have ads, Cleveland Clinic, Mayo Clinic, Johns Hopkins. And if you scroll down in this results list, you can see that while some of them, or most of them, do come from Medline Plus, eventually sometime, probably not on this page, it's not on this map, somewhere along the line, see there's that's cancer.gov, but you'll also occasionally see Cleveland Clinic, Mayo Clinic, even Johns Hopkins, the top names in this list of results. But right now I'm seeing mostly Medline Plus, which, they're citing themselves. So anyway, I just wanted to show that.
Yeah, of course. Any other questions? These are all really great. points. Okay. So let's talk about programming, which it kind of sounds like we're already moving in that direction based on what folks are putting in the chat. So this next group of resources, oh, can you share the handout again? Yeah, of course. This next group of resources can be really useful when you're programming or planning programming around like a month, like breast cancer, mental health, whatever it might be. So I'll talk through some programming ideas you can host in your own libraries or your workplace. But before we dive into that, let us know let me know rather, what type of health programming you have offered in the past or wish you could offer in your library. Or if you don't work in a library, what has your agency done for public programming regarding mental health? So things like pet therapy or like crocheting, puzzles. I've seen a lot of this at libraries lately, especially around finals week. If you're at an academic library, our library is really great about putting out fidget spinners and building your own fidget spinner, painting, things like that to reduce stress and anxiety. And of course, there's always those lovely, adorable dogs that come and we can pet. But if you've done anything like that, feel free to share. Puppies and pizza. Oh, I love it. That's like the best combo ever, Christine. Oh my gosh. Calm corner in a team space. That's really cool. Pet therapy, stickers, fidget toys. Oh yeah. Stress brains. Love it. Very cool. Very cool. Yeah, no, coloring is really great. Cool. Very cool. Okay, so let's go into our first one, which is going to be a little closer to home for us. It's going to be our books. So books can make it a lot easier as it sounds like some folks might work in a library. As you know, books are a great way to talk about things that are hard to talk about. Or really, if we know very little about them or are just uncomfortable talking about mental health. So the NNLM has a list of titles and other information regarding mental health topics that enrich discussions about this. So specifically mental health, which is what you're seeing on your page already. So we have a lot here, which is again just a kind of overview of the different resources that we have, being Medline Plus, NIH, some videos. But really what I want to call your attention to is our little bookshelf over here. So the main mental health page is the NNLM book club section on our website. And if you look on the right over here, you'll find some featured books that we've done. And I'm going to click on the link on the first title, Everything Here is Beautiful. So we'll go ahead and click that visit page. And what you'll find on this page is, again, just a quick overview of what the book is, a little bit about the author, a discussion guide in the right-hand corner, which is in that little gray book for hosting a book discussion. This is really good because it does a lot of the work for you. It has that discussion guide. It has that social media post, posters, reading club bookmarks, all things that are ready to go for you. And so there's a summary of that book, like I said, on the left side, and how to do all of the things if you've never hosted one. I personally have never done one, but have been a part of them, and I can now appreciate how much work goes into hosting a book club. It's not just talking about books. There's a lot that goes into it in facilitating discussion. And when we think about heavier topics, we really like to lean on these discussion guides and kind of put them at the forefront and kind of give folks time back so that they can focus on other things that might be happening. And so we've included a link to that book club section on your handout. But before we move on, are there any questions about anything in the books or the book club? And there are a lot of titles if we go back one page. Girls on the Brink, Gorilla and the Bird, Hidden Valley Road. I don't know if any of y'all have read this, any of these, but some really great titles. And it looks like we do have a question in the chat. In PubMed, you can search with the subject heading patient. Okay, cool. Jan, it looks like. Okay, cool. Rebecca's got that. Any questions about the books, though, before we move on to the next part? Got it. Love it. So let's go back to our slides really quickly. Oh, we just did that part. So in addition to Mental Health Awareness Day, Mental Health Awareness Month is in May. I'm not seeing the link. Can you please share? Yes. Let me go back one really quick. You want the one for the bookshelf, Christine? Yeah, I gotcha. Here you go. Cool. Let's go back to our slides. Oh, you're fine. So like I said, we've already talked about Mental Health Awareness Day, and you might want to plan a library event to provide information and awareness to your community. So we've kind of already gone over a lot of those resources, and we've showed you SAMHSA mental health awareness toolkits that offer a variety of resources in one central location that you can download and share out. We just did the book club, which has discussions that you can kind of look at. And don't forget, tomorrow is World Mental Health Day, October 10th. Definitely try to do something if you can, or maybe just call attention to it if you can. Help folks kind of understand why it's important. And so there's a link to the World Health Organization site as well, which has a lot of other resources. I think that might be on your handout or not. We can check on that. But we're going to close that tab and move on. And so the next one for programming is a really fun one. This is through the American Library Association. So we'll go back over here. There's a lot of fun stuff in here. Programming librarian. Sorry, the programming librarian. We'll go and do a new link in here because I think it might have opened something different. There we go. Cool. So if you're still not sure what type of program you want to offer, the programming librarian from the American Library Association is a great resource to really just kind of dive in and have fun with it. So it's a place where librarians can share and find programs focusing on health and other topics. So if you are folks that have done this, maybe you want to contribute, or maybe if you're not somebody who has done it, maybe go and check it out. So if we go on to the browse programs at the top of the page and enter mental health, which is going to be at the top on that bar next to the logo. So we'll go ahead and hit browse programs, and we can see everything's laid out for us. And you can either choose to keep your library type or whatever falls on you. I'm just going to leave it under choose. But we're going to go ahead and do mental health, which you can tell I've done this a few times. And we're going to just go ahead and hit apply. And so what it does is it brings up a lot of results for mental health. And you can kind of see them here. They're really nice images and easy to kind of navigate. But what we're going to use as our example today is Mental Health Series Ignites Conversation. And so once we get on this page, we can see that there's a lot of info on how to do the advanced planning, the marketing, budgeting, day of event activity. So these are folks that are tested and true, right? So they've already been done, and they have a lot of feedback for you to kind of learn from their mistakes or maybe do something better that maybe they didn't get to include. But at the bottom is really the meat of what you want to pay attention to. So these are the supporting materials for this thing. So you can click on any one of these and it'll pull up different PDFs for the event schedule. And the fun part is you can always kind of flex with it however you want. So if you see something you like in that PDF, maybe you take it over to Canva or wherever your source is, and you can kind of play with it and make it your own. But there is a lot of marketing, budgeting, and even advice towards the bottom of the page, which I highly encourage folks to check out. But if we keep scrolling, we see even more programs, which with my favorite program of all, Partnerships for Pet Therapy, highly recommend if you haven't done it. And you can see how that looks as well. So it gives you advice, some sources on why this is a good idea in case you need to go back to your director or whoever may be in charge of your community board and say this has been tested and proven, it would be a great resource, yada, 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 whatever they need to hear to bring the dogs in the library. Highly recommend. But same thing goes here. You can see the related links and other types of programs that might be available for you and how to. And have any of you ever hosted a pet therapy or even offered yoga in your library? I know that's also a thing. Feel free to put it in the chat and let us know. How did that turn out? And here was yoga in your library as well, if anybody was interested. Nobody for yoga? We may or may not still be on the pause for pet programs legally. Oh, so sorry to hear that, but also probably need to figure that out before and make sure it's safe, right? We had yoga and Tai Chi. Oh, that's really cool. I like that. Very cool. We have children. What was that? Pause. That's so cool. We have, what was that? We may or may not. Oh, I saw one about children earlier. Okay. Cool. Oh, therapy rabbits. We have children read to certified therapy rabbits. Oh, that is so cool. I love that. Yeah, definitely. I'm glad it's giving you ideas, Dana. That's awesome. We had story time with a therapy dog, a giant Great Dane named Gray, and also have random Saturdays with a smaller dog that just walks around the library and interacts with whoever is interested. Oh, that's so great. I hope that dog gets so many treats. I love it so much. Okay. That's so great to know that y'all are getting ideas and getting a lot out of this. So, again, that handout is going to be your best friend as we come up closer to the end here. So we've covered a lot of ideas here today, but there's so much more that we could cover, and there's some additional resources or programs that you might want to consider for your library or agency. So some libraries have brought in therapy dogs, like we've talked about, and school finals time to help students reduce their stress. So that may be an academic library, but as we can tell in the chat, you can kind of do this for any kind of situation. So that might be whether it's an academic library, a public library. Programming is always going to be very important, whatever environment you're in. Having folks look forward to something or maybe just kind of shake things up. It's always great to kind of see how folks kind of use your space, right? And use your resources. And go ahead.
Oh, I was going to, Sarah had a comment about that she's never had a patron ask for mental health resources, which is not surprising to me because I remember taking a class, reading something in library school about people just walk past the reference desk, and
Yeah.
but I think, and so she asked, have you best way to connect with people? Have you had any wildly popular passive or active programming? And I think examples of passive acting activity, signs around your library. Did you know, like we have in the lists here? So, but I'd love to hear what other folks have, do.
Sarah, I also had not, I think it's an experience, but it's really hard to kind of navigate those resources and whether or not folks are kind of needing them or searching for them. But the quickest example that I have was when I worked at a public library for a little bit, and we had a lot of young adults come in and really use our space. The Richland Library is a really good spot in Columbia for them to kind of come and hang out. But I distinctly remember um, a group of young adults really wanting books on suicide, I guess is a good way to say it. They had they were young adult books, but they were very like dark in the sense of like their content, but not dark in the sense that like they're providing like information that would otherwise be. But I think they were mostly looking for information to kind of have a story along with it. And I kind of picked up on it, and eventually, they brought the book back. They were really excited and they wanted to learn more. And come to find out they were doing a research project on it. And that's how, I was kind of able to kind of see those invisible, subtle interests, but also kind of point them to other books or resources that might be a little more helpful in storytelling. So again, like stories are a really great way, especially with young adults, and graphic novels as well for young adults are a really great way to talk about these topics. And I highly encourage, even if you can, kind of pay attention, in the books when there's a book recommendation, look and see, well, hey, if you're interested in this, you might be interested in this as well. Probing is also really important. I know we were all taught that in library school. I like to call it gentle probing though, kind of being like, where's the interest? Is this for an assignment? Have you read this other book? You can kind of gauge what folks are interested in. Is it a book for a friend? Is it a book for you? Things like that. It kind of takes the onus off of the individual and kind of makes it more general and easy to talk about. Our local public library has a really beautiful display board with web links and flyers. Yeah, I've seen a lot of those. That's also really good. For sure. QR codes as well. Alicia, definitely take advantage of those QR codes if you can and look at the different resources that we kind of talked through today and see if you can link those out in a brochure or however you want. Our fiction displays are mostly accessible, so I can do that along with bookmarks. Oh, bookmarks are also a really good way. Yeah, no, Sarah, that's awesome. I totally forgot about that. Bookmarks are really great little advertising spots if you think about it, but we don't really want to advertise, but having a bookmark with some resources on the back or even a QR code that kind of links to something that might be important, really great way to kind of get that info out there as well. I'm working with our clinic behavioral therapist. We are planning on once a month having her set up a table and have her or someone from her office be here to offer resources. That is so great. I know our library partners with social work students that are getting their masters or their PhDs here at the local university, and they're really great. If you don't have a social worker in your library, I know that can be really hard and a lot of labor, but definitely try to look outwards as well in your community, see who's there and who has the time and the capacity to be able to do that. Highly recommend always partnering with local organizations to see if that's always a possibility to get more information out and serve more folks. But really great ideas from everyone. And we'll go ahead and move to our last slide, which is questions. So I really appreciate all of you attending today's session. We're going to put that link to oh, Rebecca already did it, to the evaluation in the chat box. The evaluation is just your first step to claiming your MLA CE credit. Of course, we appreciate your feedback, whether you want CE credit or not. So please, 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 if you're able, try to complete that survey for me. It helps me better understand how I'm doing, talking too fast, talking too slow, whatever it might be. Or maybe you just wanted to see something that we didn't cover today. That's how we're able to know what it is that you like. If you don't already receive the weekly class announcement from NNLM, we have the sign-up link on that handout. We highly recommend you pay attention to that as well so that you can attend more trainings like this one today and get more CE credit. And if anybody has any questions about today's presentation, please feel free to reach out to me or Rebecca as well. Our information should be easily accessible.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.